signing these deals is going to be very important in moving forward the actual change that we want to see.
Canada's premiers have agreed to accept Ottawa's 10-year healthcare funding offer, with now the focus turning to bilateral agreements with the feds. But will this new money help fix a broken healthcare system? The deal is an additional $46 billion in new funding to the provinces and territories over a 10-year period. Canada's premiers say the offer from the federal government is nowhere near what they asked for, but the money could not be turned down.
This is just a step towards where we need to go. It's not the end of the road.
Canadian Medical Association President Dr. Alika Lafontaine says this agreement allows the healthcare sector to begin the process of fixing the healthcare system.
There's things like data that are tied into the CHT, which sometimes is a complex problem for folks to wrap their head around, but extremely important actually fixing our problems.
Emily Grunwald from Children's Healthcare Canada says she was happy to see pediatric patients included in the negotiations.
We have a growing population of children in this country, and their needs are increasingly more complex. This is a terrific start. But we're really looking forward to working with the provinces and working with the federal government to think about the long term and how we make Canada a place where children thrive.
Bachus Barua, however, doesn't think pouring more money into an already broken healthcare system is a good idea.
The question is not the money. The question is whether the money is translating into performance. And from what we're seeing over here, there's a little bit of talk of performance, but that isn't really the focus. The focus is still money.
Barua says he believes this deal will only bring forth more spending and bring more federal involvement into healthcare.
Let's be clear. Ultimately, it's not a question of whether the provinces are going to fund this or whether the federal government's going to fund this. It's the Canadian taxpayer that's going to be footing the bill.
Ottawa intends to sign one-on-one agreements with each province specific to their needs. Thomas Linner with Manitoba Health Coalition says he was hoping to see more political will from the premiers and the feds to get the public healthcare system back on track.
It looks like we are going to continue to see province by province negotiations with the federal government rather than a pan-Canadian approach, and we think that's a bit of a shame.
Lafontaine said it's important that frontline healthcare voices are part of the conversation.
It's really important for governments as they start to implement these things, especially when it comes to measuring whether or not we're moving forward, that these voices remain around the table and they inform what governments end up doing moving forward.
In Winnipeg, Alex Karpa, City News.